Welcome to Eat Your Greens with Dr. Black. Before we get started, I want to let you know that this episode is available in its usual audio-only format, but you can also find it with video on my Eat Your Greens with Dr. Black YouTube channel if you want the visuals. For first-time listeners, I'm Dr. Black. I'm a board-certified pediatrician and lifestyle medicine physician, and I'm really glad you're here today. This podcast is my way of sharing my passion for helping people just like you understand how powerful a whole food, plant-based diet can be for your health. My goal is to give you practical, easy-to-use tools to take what you learn here and make it part of your daily life. You're really going to enjoy today's episode. It's a real treat, not only for my listeners, but also for me. I'm very excited about today's guest. Today, I'm talking with someone whose work has had a huge influence on how doctors think about the relationship between food and healthcare, Chef Leah Sarris. Chef Leah is a nationally recognized chef. She's a registered dietitian, and she has spent 15 years plus building evidence-based programs that connect the dots between food, nutrition, and medicine. Earlier this year, I introduced my listeners to the concept of culinary medicine when I interviewed Dr. Jacqueline Albin, the head of the culinary medicine program at Southwestern Medical School in Dallas. Chef Leah has been an integral part of the culinary medicine movement from the very beginning. In fact, she co-developed the very first interdisciplinary culinary medicine program at a U.S. medical school, helping to launch the Goldring Center for Culinary Medicine at Tulane back in 2012. That program helped spark a national movement and has since grown into the Health Meets Food curriculum, which is now used by over 50 institutions across the country. Leah's career has bridged so many areas. She taught at Johnson & Wales. She helped to launch the New Orleans Culinary and Hospitality Institute. She led a large-scale emergency food relief effort, and she was even the farm manager on a sustainable farm. She now runs her own consulting business, Culinary Medicine Consulting, that helps healthcare systems, universities, and doctors like me bring food as medicine programs to life. Her work has been featured on NPR, NBC Nightly News, Bon Appetit, and the Wall Street Journal. So you can probably see why I'm a little starstruck, but also beyond excited to have her here today. We'll talk about her journey, the early days of culinary medicine and how it's evolved, what it actually takes to build a program like this, and where she sees the movement going next. We'll also explore which patients would benefit most from a culinary medicine program. So Chef Leah, thank you so much for joining me today. It's a real honor. And I can't wait to learn more about your work and where culinary medicine is going in the future.
Thanks so much. I love to be here and I love your podcast. So thanks for having me.
So can you share a little bit of your backstory? Tell us how you became a chef and a registered dietitian and what led you into culinary medicine?
Yeah, it's a pretty good story. So I went to culinary school at Johnson & Wales University, which if people who know culinary schools know that they have a very strong culinary program, but they also had, it's changed a little since I went, but a very unique culinary nutrition program where you could go into this 4-year program and then become a registered dietitian, do the dietetic internship, and go into dietetics. The registered dietitian path isn't always an option, especially tied to culinary programs. This was the only one really like it at the time because they have to be accredited through the Ascend program in order to then do the internship and become an RD. When I went there, I actually didn't know I wanted to be a registered dietitian at first. I wasn't even sure I was going to go through the program. I started in just a 2-year degree of culinary arts. And then you had the option of moving on to a 4-year degree. And during that time, I realized through my introductory nutrition class that I really enjoyed it. It kind of runs in my family, caring for people. You know, I had thought I wanted to be a doctor most of my life growing up. But that path didn't end up happening for me. But I thought this was another great way that I could help improve people's health and ultimately doing something that I felt good about and felt was needed. So I went into the culinary nutrition program. From there, I actually started in product development, research and development, because it was a dual track in my program where you could either do more of the science base or the more nutrition base, which could be really a wide variety of jobs that people could do. People would become sports dietitians or cook for a sports team or private chefs or work at a spa or, do educational options. So I first chose more of the science based and did research and development. And I did that for the first few years of my career, which was great. It was pivotal. I worked for a consulting firm. It really introduced me to a lot of really important aspects that shaped my career around food service. And actually still have a relationship with the gentleman that hired me at Chef Services Group, Walter Zaromsky. He's a big mentor for me. But in 2008, when the economy tanked, consulting was one of the first things people cut. So I got cut to half time, which, at the time was hard. I was young and pretty fresh out of college. But in the end, like many of these things happen, ended up being a blessing in disguise. I ended up picking up a few more jobs, improving nutrition education, and school lunches in schools throughout Rhode Island, where I went to school and I lived. And then also I started eventually farming as well. So I was learning all these kind of different areas that I wanted to do. And then I also became an adjunct instructor at Johnson& Wales. So I started teaching the same introductory nutrition class that helped me decide that I wanted to take this path in my career. So all first year culinary students, whether or not nutrition was their career path, took this intro to nutrition class. And I was really excited about that because I realized the influence that it can have on a young chef when they think that healthy food may not taste good, or, I loved being able to show that it could taste good and be good for you and practical applications in the lab. And so for 4 years, I was working three jobs, and which was great for my resume, but I was really tired. And as I said, by the end, I was like, I feel like I can only give 33% of myself to each one, and I really want to give 100% of myself to one
Right.
job. So I was actually teaching at Johnson& Wales, and I talked to my boss at the time, Suzanne Vieira, also a big mentor of mine who really helped to uh, elevate my career and gave me lots of opportunities. And she um, actually came into class when I was teaching one day. This is a funny story, and that's kind of I just set the stage for this story. I was in class one day, and she comes in and tells me that she has a great job opportunity on her lap for me at Tulane University, starting a culinary medicine program. So this was in 2011. And of course, I didn't even know what that meant. At the time,
Sure.
culinary medicine was not common in our
Did
vocabulary.
anybody know?
No,
I mean, very
no,
few, right?
no, no. And she just comes in excited and she's like, it's this program at the medical school, and they're going to teach medical students about nutrition. And, I couldn't quite put the dots together at that point, but it sounded exciting. And she said, the people running the program are here. She's like, I want to bring them in to meet you. So she literally told me about this during my class, handed me the job description, and then like 10 minutes later brings the dean of the medical school, Ben Sachs at the time, and Dr. Timothy Harlan, who was the executive director of the program and who I really built all the programming with, our co-founder, into my classroom. They started like asking me questions on the spot. So it was all very overwhelming. And then they invited
Mhm.
me to dinner that night, which was great. But they were going to dinner while my class was still going on. So one of my colleagues was wonderful and said he would cover the end of my class. So I ran home and I changed and I went to dinner with them and they pseudo interviewed me right at the dinner table.
Wow.
And then and then then that's where it started, my actual formal interview process and talking to him about the program and learning more. And that was in around October, I want to say, in 2011. And then I got the formal offer right around the new year. And I moved to New Orleans in March of 2012 to actually begin the program. So that was how I ended up here. And it was like, just as I've said throughout my career, talking to people, having good relationships and good contacts, good mentors, making sure that you're letting them know about any career changes or moves that you want and being open to any new opportunity that may arise. I never knew this was going to be my path, but when it came along, I knew I wanted to do it. So I moved and began the program there without a kitchen, without a curriculum. It was literally envisioning it from scratch. We didn't know what it meant. So that's how I ended up in culinary medicine and at Tulane. While
It
I
must have
was
been a big
there,
change.
yeah, yeah, I was
I mean, Rhode
also,
Island to New Orleans.
it's true. I was very fortunate. My best friend from college is from here. And so I had visited here many times already with her. And
Okay.
she had been trying to get me to move here for a long time, but I was like, I don't have a career opportunity. So it was a natural fit when it landed on my doorstep. And I knew somewhat what I was coming into. So it was, yes, it's a shock living here. It's a bit of a culture shock
Mhm.
because it's different, but
Right.
it wasn't completely new concept to me. Um, and then
It's
while I was there,
amazing
I
that
began.
you have experience though from like the farm
Mhm.
growing, and then through the kitchen and teaching and then all the way into the clinic. Nutrition and feeding people and good food from its source all the way to the table and to its impact on people's health.
Yeah,
That's
and I
incredible.
love that. Thank you. Yeah, I had a very unique career path because I took chances trying new things, but I feel like all of those different jobs I've had have been pivotal in shaping my career and ultimately realizing that I love to educate. You know, I never really wanted to be clinical necessarily. I thought about it, but I think I realized pretty soon I like being an educator. And through doing it and realizing, hey, I'm actually pretty good at this. Also, I felt like I was making a big impact by being able to reach multiple people at once and showing them practical applications of how to cook great food that just happens to be good for them. So
Well,
I've been
I
very
can attest
fortunate.
to your teaching skill because we met at the American College of Culinary Medicine conference where I took your knife skills session. And that was the first time I'd had any kind of formal knife skill kind of,
Yeah.
haven't ever taken a cooking class. So it was a lot of fun. And I still, I'm excited about taking that to my patients in the program I'm trying to develop. So I can attest to your teaching skill. We had a really good time in that class, in that session.
You. I really enjoyed doing that. And that's the kind of classes I really like doing is just little lessons that make a big impact, right? So you're not going to get great knife skills overnight, but when you learn the building blocks, like anything, you can then practice it and then you can kind of like the spider web effect because you can then teach your
Mhm.
patients how to do that. And it's not that everyone needs to be a gourmet chef, but having better knife skills can make you more efficient in the kitchen and it can also be safer in the long run when you're handling a knife properly. So I really enjoyed teaching people those little practical tidbits.
Great.
Yeah, and thank you. I'm so glad you got to come to that. I had a lot of fun doing it.
It was a good conference.
Yeah.
So, for the listeners that may not know, maybe they didn't hear my initial episode with Dr. Albin, define culinary medicine. I mean, you've kind of touched on it with your career path, but what is a teaching kitchen? What is culinary medicine? Who might benefit from it?
Great question. And the truth is, there is not one definitive answer to that. I'm actually been in discussion with the university who is doing interviews with people in the culinary medicine field to create a more specific definition around culinary medicine. But I think to most of it involves the intersection of evidence-based nutrition principles, evidence-based medicine, and also practical applications for creating food in the kitchen that is good for you. So I'd say beyond just counseling to eat a better diet, the ultimate goal would be to show people how to do it and give very specific recommendations for what kinds of foods they can eat and how they can integrate those in a practical way into their diets, rather than just saying, oh, you need to lower your sodium, or just focusing on pharmaceuticals in the doctor's office, which, by the way, still have a place. This isn't replacing them. They often can complement each other and have a greater effect when done together. Other times, by changing diet, you can sometimes reduce reliance on medication, which is great, but isn't always necessarily the case. Um, so, it's really giving physicians and other healthcare professionals, not just physicians, the tools to have those real meaningful impacts with their patients on how to improve their health. A lot of the time, it includes actual hands-on in a teaching kitchen. That's not always realistic. Sometimes it's demonstrations. I'd say since COVID, especially, there's a lot more virtual learning opportunities, which is great. I think in an ideal world, we'd get everyone in a kitchen because there's nothing
Mhm.
like actually practicing it, right? But, that's not always how these programs at least start. And not everyone has access to or the funding to have a teaching kitchen where they can actually bring in people to teach them these skills. So I'd say at Tulane and a lot of other places, there are multiple audiences for these teaching kitchens. So we started with medical students and medical professionals. So the medical students started as an elective, but then integrating some mandatory classes into their curriculum over time. And then they also could do a rotation during their fourth year in their clinical rotations where they could stay with us for a month. And we also got a wave students during then. And then we also started continuing medical education. So anyone from a physician to a pharmacist to a nurse and nurse practitioner, um, even dietitians and dentists would come to these classes because nutrition touches all of those people. And so there are so many people within the healthcare spectrum that can benefit from learning these practical applications of nutrition so they can better help their patients. And then we also did classes straight to the patients. So we would do classes for people, we would call it home ec for the 21st century. Just getting people in the kitchen,
Mhm.
giving them kitchen confidence. That's what a lot of people I find lack, is just they're afraid to try because they're afraid of messing up. So really giving them the tools and baseline skills to show them, hey, you can try this. And also it's okay if you mess up. And here's some tools if you do mess up. And sometimes you can't fix it. And that's okay. Like everything, you're going to learn from it. So actually bringing community members straight into the kitchen was also an opportunity for the teaching kitchen. So we had multiple audiences with that. And yeah, it's just so cool to really be able to get a full spectrum of audiences, from a child or a family to seniors to people living with a chronic condition to medical professionals, and be able to influence really across the spectrum of of teaching them about nutrition and food and how to make better choices and cook at home in a way that is affordable and culturally appropriate and meets them wherever they are at.
Mhm.
Yeah.
Right. I think from my clinical model that I'm trying to develop, because I'm a pediatrician, another benefit that I'm angling for is kids can be picky
Mhm.
eaters, and a little afraid of trying new things, but I think coming to an actual teaching kitchen, participating in the process with a group, learning about it, it gives them an opportunity to try new things in a really like low risk, low stakes environment where it's
Hmm.
fun. And, if they like it, great. They have something they can make with their family at home. And if they don't, well, nothing's lost. They got to have fun with the group and learn something new.
Yeah.
So I think that's a application for the pediatric population to just like get them involved, teach them some skills, have fun. And hey, maybe you try something you wouldn't have tried at home if your mom had just made it and said, "Here, eat this."
Yes, and two things to that specifically, which first of all, I think that also applies to the adult population, and to
Mm,
families, because
mhm,
especially when someone might be on a limited income or limited time, it becomes very intimidating to buy a new ingredient that you may not be familiar with, and they don't want to waste the money or the time or the resources on it. So, the same way for their parents, it's a low stakes way to try something new and know if they even like it before they spend their money on it. The other thing I'll say is I agree. When kids are hands on, I mean, I learned this early on when I was helping improve school food in Rhode Island, is that when kids saw food grow on a farm or picked it, or when they saw it from its raw state and they were involved in the process of taking a potato and cutting it into wedges and putting it in an oven,
mhm,
they were much more open to trying it because they were involved in the process. And that has a
mhm,
huge impact, as you said. So I completely agree that it's much different than just putting it in their face and saying, try
mhm.
it.
Yes, right.
Yeah.
Tell me more about the Goldring Center for Culinary Medicine at Tulane. You were instrumental in launching it, and I am interested to know what inspired it. What was that journey like trying to build that curriculum from scratch?
Mm,
I mean, you said you got there and there was nothing in place.
yeah.
That must have been daunting. And, how did you take it from nothing all the way to where it is now?
Oh, it was, at first, it was quite intimidating, but we got through
Mhm.
it. A lot of it is trial and error. And also for me, it was learning a lot about the medical field as well. Luckily, I had Dr. Harlan there next to me to help introduce me to a lot of these concepts and how the medical school works. And so that I was very fortunate to have him by my side to help with that transition. Um, when I first came, it was funded through some philanthropic dollars, through the Goldring Family Foundation here in New Orleans, which is where the name Goldring came. They gave the initial seed funding to begin the program and also to build a teaching kitchen. And this actually all came about from a parent who had attended a conference called Healthy Kitchens, Healthy Lives, that is put on through a partnership with Harvard at the Culinary Institute of America. And that was early on an opportunity for physicians and other healthcare providers to go do some hands on learning about food and nutrition. And so after a parent attended that, that was an alumni of the medical school, and their child was also going to Tulane, if I remember calling this correctly. And they approached the dean and asked him, why aren't we teaching this to medical students? Get them while they're young, while they're still in school, when on average they have maybe 16 hours of nutrition education and nothing about it is practical. It's all really biochemical. But why aren't we
Mhm.
teaching them about how to talk to their patients about food when their patients are listening to them and they want this advice? And we know that the vast majority of them have a chronic disease that is heavily impacted by nutrition. Why aren't we doing this? And, you know, Dr. Sachs said, that's a great question. And that's how it started. He understood the vision, and Dr. Harlan was on faculty at Tulane, and he has a background in nutrition and also culinary. And, he actually ran a restaurant, and he started in the restaurant business before he ended up as a physician. And he really already had his own career around teaching patients about what to eat and nutrition. So it was a natural fit for Dean Sachs to go to him and ask him to help get this program launched. And so they started working on it together, found the donors for the seed money to begin the program. And then they were looking for someone who would be able to do the operations, build the program, be day to day. And originally they had talked about a partnership with Johnson& Wales because they have this culinary nutrition program, which is why they ended up there. And they were looking for the right person to lead this program. And that's how it ended up on my doorstep when I came down here. Just everything lined up well for me in that situation. So when I first came down, there wasn't a kitchen. I didn't have an office. It was like I would float around at coffee shops or, find a table here or empty cubicle there. And just we would meet weekly, Dr. Harlan and I, and we would bring in other stakeholders who might have some skills and knowledge about either culinary or nutrition or medicine, and kind of do little interviews to get their perspective about what types of skills would be helpful. And then we ended up developing a core curriculum, and we started pretty quickly with a few classes for medical students. And then we ultimately did some continuing medical education when people started asking for it. And we partnered with the Tulane Alumni Association, which was really a great partnership for us because it gave their retired physicians an avenue to continue their education. And actually, a lot of the people who helped to build this culinary medicine momentum started from there. So it was a lot of it was just trial and error, learning as we went, seeing what stuck, listening to people, doing surveys, so that we have both qualitative and quantitative evidence to help support whether or not what we were doing was effective. And over time, we just continued to build our audiences and build our modules that we were doing. And actually, you brought up Jacqueline Albin. Funnily enough, they were some of our very first licensees of the
Oh,
program.
wow.
Yeah, we weren't planning on license. It wasn't on our radar on licensing the program. And then Moncrief Cancer Institute, who has a partnership with UT Southwestern, they heard about a program and they approached us and asked if we license it. And we were like, that's not a bad thing. Yeah. And that's how we started licensing it.
Cool.
And ultimately, to this day, that's not a huge money maker. It's a way to make this kind of programming more accessible to people around the US, because it's a lot of work to build this from scratch. And most medical schools or any educational institution, they just don't have the resources and time and nor the right people to put into practice actually building out a whole core curriculum of culinary medicine modules. So we started licensing it out to schools at that point. And now it's actually grown to not just be medical schools, but dietetics programs do it. People do it for the community courses. And also they started licensing and doing certification for chefs as well. And that's also one thing that eventually came is as we were building out our modules, we created a certification program in culinary medicine, which was the first of its kind. So practitioners can become a certified culinary medicine specialist, which is an accredited program to show that you're competent in the area of culinary medicine, and it's open to a whole bunch of different healthcare practitioners that I mentioned before. And so that's the CCMS, Certified Culinary Medicine Specialist. And then in the last few years, they launched the CCMP, the Certified Culinary Medicine Professional, which is for people in the food service realm. So they can also take this into culinary schools, into healthcare, various capacities, into schools. So, institutional settings, and make a greater impact and improve that nutritional knowledge for beyond the healthcare professionals, also doing it for the culinary professionals and food service professionals. So it's just kind of naturally grown and progressed over time as the needs have grown. And
Hmm.
yeah,
Well, I'm definitely benefiting personally from all of your groundwork and development. I consider Dr. Albin kind of my mentor. I'm modeling the program that I'm building on what she's doing there in Dallas with
awesome.
the community partnership to, like with a local church to use their kitchen space and
Yeah.
their space to host their sessions. But I am learning about how much work it takes to
Yeah.
build it from scratch. And I am very grateful for the existing curricula that I can take advantage of, both through American College of Culinary Medicine, also the American College of Lifestyle
Mm.
Medicine. There's now a few of them out there,
Yeah.
some with dedicated pediatric lessons that I don't have to just like create it from the ground up. I can utilize those. And I do plan, I have not yet because I just did my board certification in lifestyle medicine at the end of last year. So I do
Congratulations.
plan, no, thank you. Yeah, I do plan to do the CCMS course. I just felt like if I keep training for it and planning for it, it'll never happen.
Yeah.
So, I'm going to get the framework started
Good for
and
you.
then start building from there. We're trying to hire a dietitian. Now, we're
Ah.
not a teaching, we're a private pediatric group, so
Hmm.
I'm not academic. So I don't need the entire,
Yeah.
medical education curriculum. Although I would love, it's on my list of things to add in the future
Hmm.
to invite residents or medical
Yeah.
students from, we have probably 3 or 4 medical schools in the Austin to San Antonio corridor
Yes, you do.
now,
There's a lot.
and so, yeah, eventually I would love to reach out to them and just like, "Hey, send a student or a resident down, and they can sit in on a
That's
session or volunteer, help out, learn what it's like," and so it's on the very long list of things that I wanna do.
I know,
Let
me
me just
too.
get
Don't we
started.
all?
Mhm,
I have a long list
exactly.
of things I want to do too. And yeah, you got to start somewhere. And there is so much great overlap with the lifestyle medicine course because obviously, nutrition and healthy eating is one of those pillars of lifestyle medicine, but we do know that it does extend beyond there. And that there are so many other parts of our lifestyles, from exercise to mental health, that are important to address in order to improve our overall health. So good for you for starting there. And there are a lot of people who do, both certifications. There are multiple resources, which is great. I love that people can learn this now. At one point there were none, and now there are a few different options. So, there's no, we aren't at that point yet where it's oversaturated at all. So there's
No.
plenty of opportunity for people. And really, there's still a lot of growth in this area. Although it's come a long way since 2012, there's still a
Mhm.
ton of growth and a lot of people who still don't know what this is. So there's still a ton of opportunity there. And good for you for starting this program. You got to start somewhere. And I got to say, Jacqueline Albin and Millette Seiler at UT Southwestern, they're amazing. And what great
Truly.
people to help you. They have done so much for this field. Like, they have just taken it and run with it. They're doing billing, they're doing, shared medical appointments. They've done a bunch of research. So I really, good for you. I can't think of better people that could help you through the process, truly.
Yeah. I'm so fortunate to be near them.
Yeah,
Absolutely.
that's fantastic. Still very close with them. I love to follow all the great strides they're making.
Mhm. Yeah. What do you predict about the future since, different physicians like me are starting to build these programs in their communities? We're seeing a lot of talk about it at the policy level.
Hmm.
Where do you see culinary medicine going in the next 5, 10, 15 years?
I hope that it starts to be more deeply implemented into medical education. And also from that, there creates more funding and opportunities for people to actually do hands-on, culinary skills and re- culinary medicine classes more widely throughout the US. And I also hope to see that with this food is medicine momentum, medically tailored meals, medically tailored groceries where people can prescribe foods to people with chronic conditions. I see culinary medicine as a natural fit as an educational piece alongside those programs. It's great. I love that we're starting to be able to bill through insurance. And there are pilot programs now, but hopefully they see the ROI in it and people can actually bill to get fresh groceries or meals that are catered to their health condition, but that's not going to last forever. So we have to give them the skills to prepare food themselves and also to utilize the food that they're getting. So
Mhm.
my hope is that this starts to be noticed more widely as the natural fit for people that are receiving these food as medicine interventions. Um, and that we can start to show the ROI for that so that I think the ultimate problem, the reason why we haven't seen this grow more always really comes back to funding. So hopefully with more research and more awareness, which I think there are some good things happening on the policy. And I will even say from this administration, they're bringing some awareness of the lack of nutrition education, which all awareness is good awareness, right? So,
Mhm.
um, I hope with that we'll be able to continue to see it grow and more heavily implemented across the board. But people need to know about it, and then people need to be willing to fund it. And there's a lot of levels that needs to happen at. And eventually, it'd be great for health insurance to fund this. But they're a
Right.
business. They have to be able to show that, like I said, the ROI that it's gonna pay off for them. And typically in healthcare, we focus so much on treating disease and not preventing. So really, it's kind of shifting that mindset more toward that prevention lens. And that's a big thing that has to happen. That's a large um it's years of creating our medical system more on treatment rather than prevention. So that's going to take a multifaceted approach. And this is one way to start that, but it is going to have to come from other angles as well. So,
And of course, pediatrics, we're all about prevention. And
yeah.
my patients don't already have diabetes.
Hmm.
Um, once they develop diabetes, because I have diagnosed type 2 diabetes in 10-year-olds. Once they cross that and actually have that disease, they get referred to the endocrinologist, and I'm no longer directly managing their care, at least from the diabetes. We still see them for their checkups, but
Hmm.
really their relationship is now with the endocrinologist. So many of my patients, most of my patients, their diagnoses are maybe pre-diabetes. I see a lot of elevated cholesterol and some of the liver enzymes trending up. So they're already starting to develop that metabolic associated fatty liver disease, but they don't have heart disease.
Hmm.
The diagnosis that in the adult world end up qualifying patients for these medically tailored meal programs, things like that. My patients don't have.
Yeah.
And so it's another layer of challenge to get funding when they don't
Yes.
already have the disease. And I do wish, I mean, we know, I don't think it's in doubt that these programs are going to save billions of dollars in healthcare, but especially for pediatrics, they're not
Hmm.
going to do that in the next 2 to 3 years.
Yeah.
And I really wish that the insurance companies, the payers, the funders would set their sights a little farther down the road because they will benefit
Hmm.
financially, just not next month.
Yeah.
But that's the thing. They're wanting immediate results. And I'm like, well, we won't know until the kid's 50 and they
Yeah.
didn't develop heart disease. I don't know.
That's the tough thing about this research,
Yeah.
right? Is showing the long-term impact when it's still fairly new. But to your point, they're at least running models to show what kind of money can be saved within the healthcare industry through this. And some insurance companies are starting to listen. And then through these 1115 waivers, they're being able to try some more initiatives that are preventative. So maybe with that, they'll start to see the evidence and do it. I do know there are a few health insurance companies like Elevance Health. They have
Mhm.
Kofi Essel, who is a
Uh,
pediatrician
he's
also.
amazing.
Oh,
He's another
wonderful.
one of my personal heroes.
He's amazing. He
Mhm.
actually started culinary medicine. He was at George Washington University and did culinary medicine programs with
Mm.
Dr. Harlan and Carrie Dotson at the American College of Culinary Medicine. They hired him to direct their food as medicine program. So he is a huge advocate for these types of programs. Hopefully, with more people like Kofi advocating for this from the payer realm, we can start to see more impact. So we're still early. So yes, 5 to 10 years. I think we'll see some growth in 5 to 10 years, but I think hopefully see even more in 20 to 30 years. These things take time, unfortunately. But
Mhm.
I think we'll continue to see growth over our lifetime, which is exciting, but we also wish it would happen a little faster.
Well, I hope that what I managed to do with my group, another thing on the list is to collect all the data and, maybe turn it into some kind of publication. Just contribute to the fund of evidence that, that's out there in the zeitgeist just to help
Hmm.
um,
That's
promote
critical.
these programs long term.
Yeah, that's really critical. It's coming out more. I mean, people like Jacqueline are doing a ton of research around it already. So hopefully we'll continue to see more and more research around this, which will help our cause in the long run considerably, really. When we first started in 2012, there was none. So just looking at how much it's grown since then is, I think, really encouraging.
Right.
So, yep.
Another area that I'm passionate about in our practice, in our community, and with my patients is food insecurity, which is,
Mm,
of course, a growing problem rapidly. We have partnered with our local food bank. Fortunately, we live in the county seat, so we can work directly with the Hayes County Food Bank. And we have a food pantry, so they get bags of non-perishable food that they can take home directly from our office, our patients. And then, we help support them if they need to actually get set up officially with the food bank for their distributions, which include fresh produce and, things that we can't keep in our office. One of the ways that I see having a culinary medicine program benefiting the patients is they may have a very limited selection of things
mhm.
that they get from the food bank. And, what do I do with this bag of lentils or can of chickpeas or, this is the produce they gave me. We want to reduce food waste and help people, to enjoy and know what to do with that food. So I'm also hoping to partner with the food bank and I've already been in, the director and I think I can say we're friends now and maybe develop some recorded, video sessions, kind of like what you're doing with your YouTube channel and with the American College of Culinary Medicine.
Mhm.
Okay, here's me making a stew with these chickpeas, or, here's what you can do, and include a little recipe card and a link to the video.
Yep.
So if they get that, then they can know what to do with it. Talk a little bit about how you've seen culinary medicine interact with the equity,
Mhm.
food insecurity
Yeah.
environment.
Yeah, that's a really important perspective to take because I think one thing when we talk about culinary medicine, we have to be careful to not be using hard to get or costly ingredients and culturally appropriate recipes and ingredients. making sure that we're not diminishing cultural foods, and also considering those social determinants of health, all the other factors that go into people's experience and what they eat outside of just, you know, what's in their home, but what's around them, what they're surrounded by. Obviously, the inequity pieces of it. So I think it's really important to make sure we have programming that it's going to have to be adaptable and change based on the population you're reaching, because not everyone is going to be the same. So actually utilizing it in a way that resonates with whoever you're teaching. So like, you mentioned the food bank. Yeah, I think that's really important. And some work that I've done is actually creating modules around how to actually utilize and make the best of those types of ingredients that are common in food banks, in order to make sure that people know how to use it and reduce waste. There is a lot more people focusing on, you know, allowing people more choice in what they get in these boxes from food banks, etc., so that they can choose food that is more familiar to them and in that they know they enjoy or their family enjoys, so that it doesn't just end up in the trash. There's actually some research to suggest that there's a lot less food waste by providing that level of choice. And of course, I recognize there's a lot of challenges in doing that, but hopefully we start to move more toward that model. But I think that's also to your point where education is critical. We need to be doing these initiatives alongside the education with how to actually utilize that food. And we have to make sure that what we're teaching is within reach for that population. So that is, to me, a core value of culinary medicine, is making sure that it's being taught in a way that is equitable, and also taking into consideration the other social determinants of health that go alongside that. And I will say in the last 10 years or so, I think there's been a lot more focus on this area, which has been really great for the movement and making sure that we're creating resources, recipes that do help to make sure we're meeting those needs. And I love that you're talking about doing this in partnership with the food bank, because I think that's a huge opportunity that some people are starting to take. But that is the reality of some people, is that's
Mhm.
all that's the food they get, or
Right.
some people might shop at a corner store.
Mhm.
So how do you make the best of those ingredients? Is it going to be, you know, are they going to get a ton of fresh vegetables and unprocessed foods? Not always, but you got to make the best of, because that's our food landscape of where it is right now. So we have to take that into consideration. But there are ways we can really improve the nutritional content of the food that we're making, even from shelf stable foods. And there's a lot of great shelf stable options out there.
Mhm.
Canned vegetables and canned fruit are great options, especially for those people that can't get the fresh options, but they just need to understand what to look for and how to use them. And so there's huge opportunity there for education as well. Our food bank here is fantastic, but it's pretty far out there. It's far away from the city, and it's mostly an industrial area. And
Mhm.
so they started doing mobile markets for that same reason, but they had to find the funding and the resources to actually build out that type of program. But that does show what we've learned since we've started these types of programs, right? So when we started food banks, this wasn't necessarily on our radar as a way that we needed to meet people. But then as we learned and we started to do more research around it, we realized the food sovereignty piece is a really important aspect of it. So people are starting to move in that direction, but it still requires, like everything, funding and logistics to go along with it.
Logistics, parking, everything.
Yeah.
So I mentioned that you are creating some videos, teaching these crucial, like basic teaching skills on YouTube with the American College of Culinary Medicine. So what videos are in the works? What do you have coming? I've already watched every single one of the ACCM videos. Like I
Great.
binged them. I did like, what am
That's
I going to
great.
learn next? What's coming?
So quickly, I have my own videos, but I did one with ACCM as well. So,
Right.
but
That's true.
I still do a lot of work with them through my consulting business. And I recorded the video you saw actually at the conference that we were at. They did a lot of recording while we were there. And so we're kind of doing similar things with little micro lessons. So there's a lot of overlap. I'm building out a library. I have a monthly newsletter that
Mhm.
focuses on a specific topic around culinary medicine. So, for instance, last month it was around oils and fats and knowing, when to use what type of oil, nutritionally, what's better versus not, cutting through the myths, making sure people understand things like smoke point, and then actually using an oil to make a green sauce. And helping to reduce waste in that way by using greens or herbs that might be going bad. So I've been building up a library of ideally 5 or less minutes. I'm still working on that. Some of them go a little above five
It's
minutes.
hard.
It is because I have so much I want to say about it. But I'm working on micro lessons to create library of resources for people in short doses that they can then practice so that it's not overwhelming to start learning these practical culinary skills. And eventually, what I would like to do with that is create an online learning platform. So, this is like the beginning of me getting my feet wet and trying to do something for healthcare practitioners so they can, while you may be doing these certifications, this would be alongside them. So, it would be like, okay, this week I'm going to practice my knife skills. This week I'm going to learn how to sharpen a knife. This week I'm going to understand a smoke point of different oils and what to apply where. So rather than, like American College of Culinary Medicine, they integrate those skills into their classes, but they're also wider topics of like, you know, or ACLM or whoever is doing this specific eating patterns for diet, for diabetes or heart disease or pediatrics or whatever that may be. I'm more focusing, honing in on the culinary skills that go alongside that so that they can just help to strengthen people's general, both culinary and teaching skills, and then the practical side of it as they're helping to teach people. So this is the beginning of that. And right now I'm putting up about a video a month. So I hope to be able to continue to grow that. And the American College of Culinary Medicine is doing something similar where they just have that library of like knife skills and other types of skills that people can utilize to strengthen their kitchen confidence, really.
And I did watch all of yours. In particular, I made notes, your vinaigrette one where you
Yeah.
give, here's the different main ingredients in a vinaigrette, and then
Yeah.
you get to customize,
Yes.
which oil, which acid, which
Mhm.
flavor addition, and so I'm really excited about
Yeah.
that.
Thank you.
It was great. Great skills.
I'm glad people are
Where,
watching them.
yeah. And I will put links. So make sure you send me all your links. I'll make sure to put them all in the show notes so my listeners can find you. Where else can they find you outside of the videos on YouTube?
Yeah, actually, the best thing is to go to my website, culinarymedicineconsulting.com. And I have a recipes and cooking resources page where I list all of my resources that I've made. And you can also sign up for the monthly newsletter there, where I share some kind of tidbit and a video that goes along with it. And there's also in that on that same page, there are my past newsletters, so you can access those as well.
Great.
Yeah.
I really appreciate you joining me today again. I'm excited about getting to know you better and the direction that this is taking, and just having the opportunity to really benefit from all of the exceptional work that you have done and your colleagues in building this to where it is today. So thank
Thank
you
you.
so much.
Thank you. And while we were able to start at Tulane because of a really supportive administration at the medical school level, So many other people have expanded the reach and depth of the culinary medicine field since then. So I'm excited to see its continued growth as well and all the amazing things so many people are doing. So thanks for having me. This was really fantastic. And I also look forward to seeing more of what you're doing and getting to know you more and also listening to more of your podcasts.
Well, I'm certain our paths will cross. I hope you enjoyed this conversation with Chef Leah Sarris as much as I did. It was a real privilege to talk with someone who's been at the forefront of the culinary medicine movement since the very beginning. We covered a lot of ground today. We talked about how Leah's unique background as both a chef and a registered dietitian led her to co-create the first culinary medicine program at a U.S. medical school, what it was like to build it from scratch, and how it's grown into a national curriculum used by institutions around the country. Personally, I especially appreciated her reflections on working with food insecure populations and designing programs that are culturally relevant and grounded in the realities of everyday life. It mirrored what I aim to do with my own program. Culinary medicine is all about teaching real-life cooking skills. It's about making nutrition education practical and helping patients feel more confident in the kitchen. Chef Leah's passion for this work really shines through, and I came away feeling inspired and even more committed to bringing these ideas into my own practice and community. If you are curious about what you can do to eat healthier or to just make cooking feel less overwhelming, I encourage you to check out Chef Leah's kitchen skills tutorials. I've got the links up here, or you can find them in the show notes for my audio-only listeners. Thanks again for listening, and as always, don't forget to eat your greens.